Morning, everybody. Thumbs up if you can hear me. Great. Hope you all had a nice weekend. Feel like it's been a while since we've chatted. Malia, how was your weekend?
Hi, good morning, everyone. My weekend was good. I did a whirlwind trip to Milwaukee for a friend's wedding from residency, and was nice to eat some frozen custard and try the Bloody Marys that they're famous for. And then on my way back from Medford yesterday, gosh, I'm so sorry, it's really bright in my car. I just had a chance to reflect a little bit about what this time of year means to me and to us as an organization, and kind of thinking about the transitions of the seasons as we close up on summer and get ready for the changes of the colors of the leaves and new beginnings for our residents and many of our new providers. It's kind of a nice time to reflect. And I think as much as the annual reviews are kind of a pain sometimes, it's also nice to have a chance to meet one-on-one with our providers and our direct reports and think about what accomplishments they've made this past year and things they're still working on, and doing those same kind of reflections for ourselves. So as we get back into the routine of, for those of us with small kids, getting back into the routine of school, I'm still in my car because I couldn't get to work on time today. I just hope that we enjoy the month of transition and keep kind of reflecting on what we've accomplished this past year. Back to you, Kelvin.
Thanks, Malia. Yes, transition. I think that is the word of the day for us, especially for this meeting. The only thing that's constant in life is change, right? And so let's talk about some of the changes that are happening, not only clinically, but also within our organization and within our community. The first things first is I want to share with you, we made some changes thanks to Ilio over the weekend on kind of revamping our hub, our intranet. So I will share screen. Can you all see that? Right, it's the hub. So as you can see, with changes, right? So you can always go to clinical resources. Don't freeze. Okay, there we go. With our clinical resources, you can see lots of things here. But have you noticed right here, COVID-19 has disappeared. It's no longer, it's going to be in its own section. Instead, we combine COVID-19 into a new section we call respiratory viruses. It's only appropriate, right? Because COVID-19, the way we should treat it like any other respiratory viruses, including, flu, RSV, rhino, and whatnot. And so the COVID-19, if you're looking for it, no longer exists. It's now combined to what we call the respiratory virus. And so if you click on the respiratory virus section, it will lead you to all the things that we've been talking about. And so if you click on algorithms, we updated recently some things. The first thing, I want to break it up into the respiratory season as we're approaching it, is into two different categories. The first one is diagnostic and prevention, and the second thing is going to talk about vaccination. So thanks to Don, we updated the respiratory illness diagnostic test options. It hasn't been updated for a while, and so when you click on that, it now will give you a the options for the three main things that we want to test for. It's like you have to refresh every time when I change it. So there we go. Let's see if I can zoom this in so people can see it. There we go. So we used to have lots and lots of options. We no longer have the Cepheid, which is the PCR confirmation test for COVID, because it's not really needed anymore. And so now what we list here is COVID-19, flu, and RSV. And of course, given that the treatment for flu, COVID-19, and RSV is usually supportive care, I want to caution all of our clinicians to only test if the results will change or affect clinical management. Because if it doesn't affect clinical management, why test? That should only confirm what you already know. And so as you can see with COVID-19, now all of our sites have the Binax. That is the point of care. That is the preferred. Should you Not sure why you would want to send out for a PCR confirmation. You can send out to public health or LabCorp, but that will take longer. So this is our preferred one, is the Binax. And of course, patients have access to home tests as well. And so it's easily available to people at home. And if you really think you want to change your management, then you can do the point of care. That's the back office. With flu, same thing. We have a point of care back office flu only antigen. Should you, for some reason, want to send it out for confirmation, you can do it for public health. That's only for Humboldt County and LabCorp. But once again, not sure why you would do that. And so we'll see how it goes, Don. But maybe in 2 weeks or so, maybe we'll just eliminate all of the ones in black and just only do the preferred, because then it won't confuse people. So let's work on removing all the blacks. We'll see how it goes for 2 weeks or so. But maybe before next meeting, we'll probably exclude all the blacks. This is just for completeness, but people should only be doing the green ones. And of course, RSV, there's no point of care, so you would send it out, but it's usually supportive care, and you can send it out to public health as well. So that is the respiratory illnesses diagnostic test options. If you also remember back in our COVID days, we used to have one that says, oh, if I have to do, how to diagnostically test somebody, how to treat somebody, what happens, when can they return to work? Well, as you can see, it no longer exists anymore because all of the treatment is the same. And so we actually reference, if you click on preventing spread of respiratory viruses when you're sick, it will actually lead you to the CDC website. And the CDC website lists all of the respiratory viruses, flu, RSV, COVID, and rhinovirus, blah, blah, blah. And it actually will tell you when you can return to normal activities. In this case, 2 criteria: when your symptoms are getting better and you are afebrile without using a fever-reducing medication for at least 24 hours. That applies to all of them. Easy. Common sense, right? Back in the days in 2019, before the pandemic, was if you're sick, stay home. If you're feeling better, then you can return to normal activities. And of course, no fever for 24 hours without using any fever-reducing medication. And then the question is that, what about masks? It also lists here on all the examples of when you can return to normal activity. So this applies to not only COVID, but flu, RSV, whatnot, and it'll tell you right here. And so you can go to the CDC website for further information. And that's what I want our nurses, our clinicians, when giving people basically preventive and also treatment advice, to follow, treating all respiratory viruses in a similar fashion. Next one would be the second part. Instead of diagnostic and prevention, now we're going to talk about vaccination for respiratory viruses. So if you go back to the respiratory viruses section, you can go on to the respiratory virus vaccination resources as well. But we listed one up here for you to know about. It's called respiratory virus season immunizations. If you remember from the past, we actually carefully created a very good seasonal vaccine administration timing. It gives you an idea of, for the 12 months, what applies to what. So this is a good overview. But now we can go into the actual respiratory virus season immunizations, which is applying now until about the month of April. And it gives you, it referenced CDPH. So here we are. Respiratory virus season immunization, specifically fall and winter vaccinations. And so we're talking about 3 things: flu, COVID, and RSV. So I want to go through each of these 3 vaccination options for you. So first, with influenza, flu, who's eligible, 6 months and above. And then for some sites, we are getting the flu vaccines right now. The best time to get it, I actually think you can start waiting until October or November, depending on your risk factors, because you want to get that full protection up until the winter and then early spring season. Some sites are getting their flu vaccine supply right now. My recommendation is, let's hold off on it. I don't want patients to get confused. They can go to ECHC and yes, they can get the flu, yet they go to Arcata, they can't get it. So all sites, as we're getting them, we're going to hold off on the flu vaccines, giving them out until I get all of the sites to get their VFC supplies. And then at that time, I'll let Carolee know to notify all of our vaccine coordinators that they can start giving out the flu vaccine. So right now, not to worry about it. Now, that's for patients. For staff, I will also give you guidance later on, but we don't have to worry about that until probably October. You don't have to get it so soon. I know that some pharmacies offer them as early as August. It's kind of counterintuitive to do it so early. And then when flu activity is kind of low right now, you want to prepare yourself when flu activity is actually higher later on in the season. So that's the first one. The second one is the COVID-19 vaccine. They just approved a new batch of the 2024-2025 COVID-19 vaccine. We haven't gotten them yet. They're coming soon. So when they do, we'll let you know, and then you can start offering to the patients. There was some rumors that they were going to have the options of combining the flu and COVID-19 vaccine. That is not available this season. They're probably going to plan for the season of 2025 to 2026. But as of right now, they're separate vaccinations. Last one, the one that's most confusing would be the RSV. So RSV vaccines have availability for 3 populations, or pregnant populations, or infant and toddler population, and then our older adults populations. So let's talk first with the pregnant patients, which is the Abruzzo. That's the name of the vaccination. This is for pregnant patients. Pregnant patients is very specific. They should only get it between the month of 32 to 36 weeks EGA. And they actually can start getting started in September 1st. So the Abruzzo is started right now. Pregnant patients between the 32 and 36 weeks EGA, and our pregnancy sites actually have them available. One thing I want to note, CDPH says this thing. It says pregnant patients during weeks 36 to 32, 36 weeks of pregnancy who have been received RSV vaccine during a prior pregnancy. That is incorrect. This part is incorrect. Hopefully CDPH will correct that. But you give the RSV vaccine at every pregnancy. It's the same way as the Tdap. So, you know, because remember, it's specific to that RSV season, right? And so even if I was pregnant last year and I got the RSV, I'm pregnant again this year, and I'm at 32 to 36 weeks during RSV, I would still be eligible to get another RSV vaccine. So that is incorrect. It's at every pregnancy, just like the flu, Tdap, RSV. It's at every pregnancy, and so that's available right there. Or so you can do the one of two ways, right? If you're pregnant, you get the RSV vaccine, then your infant does not need to get it. You don't do both. That's double the whammy. You only need one or the other. So if I, as a pregnant person, did not get the RSV vaccine when I was pregnant, because it's such a small window between 32 and 36 weeks, then my infant is eligible during RSV season. So that's all infants from birth until 8 months, or 8 to 19 months if I have a risk for severe RSV disease, then I can get the infant RSV vaccine, which is known as Nirmatrelvir/Beyfortus. And that you don't actually have to start until October 1st. And we're trying to get more of those vaccines available, but ECHC Peds should have them, that we saved them from last season. So that's for our pregnant patients, and then our infants and toddler. Finally, our older patients, it's for 75 plus, or if you're 60 and over and you're at higher risk for severe RSV disease, then you can get the RSV vaccine. 2 caveats with this. Number one, you only need to get this once in your life for the older population. And 2, we do not have that available at our clinic, so they can get it at their pharmacy as well. Keep in mind, OD Pharmacy does not carry any vaccines, so don't be sending them there. So other local community pharmacies, they can get their vaccine for the adult RSV. Okay, so that was a mouthful of vaccination for fall and winter. Keep in mind, I will review this again at next month's meeting. I just want to get you prepared for this, because people have already started asking for it. The next one is, just want to bring your attention back to our clinical hub. If you go down all the way to this section, we actually have a public health alerts. And so if you click on the public health alerts, it tells you, so most of these things are no longer updated. I mean, are no longer relevant. But the one that's most relevant is the public health alert for Shigella clustered. And so if you click on that, it will lead you to our public health alert. In this case, they specifically wanted us to know about Shigella gastroenteritis happening in Humboldt for the last 3 or 4 weeks. They've identified about 3 or 4 cases, but I think it's probably undercounted. Remember, with Shigella, symptoms usually present within 1 to 3 days of exposure. Usually it's diarrhea, abdominal bloating, fever, lack of appetite, malaise, and you can diagnose it with PCR, and you can send it to public health for that. It will tell you on page 3 of this notice what to order. And of course, treatment. Sorry, when I have Zoom on, Teams try to interfere and it freezes up my computer. And so treatment can be started, and I list you to it here. The options, azithromycin and ciprofloxacin are some options as well. And so that's just a notice I wanted you all to be aware of with the public health alert. Okay, with that in mind, we're gonna take a quick shift to now letting you all know about annual wellness visit. Our annual wellness visit outreach, to be specific. As you know, for our Medicare patients, they qualify for certain benefits, one of these things being annual wellness visit. And we actually participate in this thing called the ACO for all of our Medicare patients. It's a way for us to get some savings by keeping our Medicare patients healthy and keeping them out of the hospital. And so with that in mind, our QI team led by Valerie want to remind you about our upcoming outreach for annual wellness visit, along with our other Medicare patients as well, to be a part of our ACO for that. So with that in mind, I know that Valerie is driving right now, and so I will share screen for her. Valerie, are you there?
Good morning. I am. Can you hear me okay?
Yep, I can hear you. You want me to share the email you had
send
sent,
the
right?
summary. Yeah, that'd be great.
Okay, so I
So
will
as
share
Kelvin
screen.
prefaced, we've been doing a lot of work, as many of you all know, around our ACO, or Accountable Care Organization patients, which is essentially our managed Medicare population. So in a similar way as we receive payment for our PHC patients, we have the potential to earn extra dollars, or what they call shared savings, for our Medicare patients. We started outreach to patients who are in our Medicare ACO, but we haven't seen in 10 or more months. We started that in July. So part of this email summarizes the attribution risk in bullet number 1 and explains who this is, why we need to do outreach to them, when the outreach will happen, and what action is needed by the health center. So in order to retain attribution, so meaning that they will stay in our managed Medicare population, we need to see them annually. When we don't see them annually, they will no longer be attributed. They'll still be our patient, we'll still see them, but that patient, if we don't have an annual visit, we're no longer eligible for any shared savings for that patient. So we want to get them back into the health center for, probably in most cases, a chronic disease management visit if they have diabetes or hypertension. If they're relatively healthy and don't need much, then an annual wellness visit is another great opportunity to see that patient. Health centers will need to make that decision at the time of scheduling. So communication to your schedulers is going to be important. The second group, which we have not started yet, but we will this month, in 2 weeks, we are going to start sending messages to patients who we have seen but have not completed an annual wellness visit. We know that this will be a pretty big number of patients, so we're going to do some prioritization. We'll start with patients that have never had an annual wellness visit, and we will break patient outreach by health center into manageable chunks so we do not overwhelm you. We will be in communication with your health center leadership teams to determine what that manageable chunk is for your location. So again, this will, bullet number 2 here talks about who this is, why it's important. We need to hit a 35% target of annual wellness visits being completed on our entire managed Medicare population, and we have about 10,000 patients. We're working towards this. We're not at zero, but we need to hit that 35% threshold in order to retain those shared savings or extra dollars for these patients. Isabel did update a scheduling workflow for annual wellness visits. We'll talk more about that at site medical directors, but we'll also make sure that it's available in advance, since site medical directors will fall right before outreach begins. So should you have any questions, please reach out to me or Isabel or Chris or Malia. We're all supporting you in this work, and we really appreciate your effort on this.
Great. Thank you, Valerie. So just a reminder again, right? We're trying to find ways to make ourselves financially sustainable. One of those things is participating in the ACO, specifically for our Medicare patients. And one of those ways is making sure, number one, we are connecting with them. That's the first bullet point, if they haven't been seen. And the second one is they are entitled to an annual wellness visit. And as Wayne was asking on the chat, this is very different from a physical. An annual wellness visit, most of the time, the components that we're doing for them is making sure we address their daily livings, screening them for dementia, screening them for fall risk, making sure they're up to date with the advanced care directive, the post, things that we normally don't have the time to do in an actual visit because it's more problem-based. This one is more preventive-based and making sure that they are aware. And you know, I've done a lot of these in the last 6 months or so, and I found that a lot of my patients very appreciative because it actually gives me a chance to talk to them, not medicine related, but more about their social aspects. A lot of my patients don't have advanced care directive. They oftentimes don't know who's going to be their durable power of attorney should something happen to them. We also spend a lot of time talking about their polls and having these hard conversations about, if you are unable to make the decisions, who's going to be the next person in line to do that? And have you communicated your wishes to these people? And so just keep that in mind. This is very, very different from just ordering labs and whatnot. This is about evaluating them from a social perspective. And then they have that. And so that's our goal, is to do our annual wellness visit for Medicare patients, where our goal is to hit 35%. It's a very lofty goal, but and once again, all these challenges, we're able to do it if we work together. So that is that. So with that in mind, as we're wrapping up the meeting, I just want to bring up some organizational update. The first one is just a reminder again for people, Workday, make sure that's your way of doing time card. Remind your direct reports to complete it each week. And of course, if you are going to copy a previous week because your schedule is the same, make sure you check on that box that says also copy details and comments. Otherwise, it does not pull the previous details or the comments over, and it will just look blank. Even after you do that, what I usually recommend is to go through each day and confirm the exact information on there. Second thing, like Malia mentioned earlier, annual performance, right? The month of August is over. That's when we were all supposed to do our self-evaluation. Now it moves on to you as managers to start scheduling your one-on-one with your direct report. So use the month of September, October to do that. Keep in mind on Workday, I know that you have asked for information on how, like, for example, if you're evaluating Joe Smith as one of your direct reports and Joe Smith work closely with somebody else, you can request feedback from them on Workday just to make sure that you have a complete picture when you're doing their annual performance as well. So just keep that in mind. And the deadline to have everything done, meaning meeting with your direct report, completing your section, reminding your people to complete their goals for the year. The deadline, we want to finish all of this by December 6th. But of course, please don't wait until December to do this. Do it sooner rather than later. We don't want it to be like what we did with our compliance training and wait till the last minute as well. So that's that. Lunch and Learn is coming back. We took a summer hiatus, but summer Lunch and Learn is coming back with a different format. It's going to be a component, a combination of talks, Lunch and Learn, along with didactics, case review, peer review, and the first one is going to be on October 4th. That's the Friday of the first Friday of October, and we're going to be discussing pulmonary hypertension with UCSF cardiology. And then last thing, I want to let you know about, most of you have already known, but I want to just address this as well, since we have not had the chance to talk about this. 2 weeks ago, we found out that Mad River has decided to close their labor and delivery. They were trying to close it at the first week of October. Tori met with Doug Shaw, the CEO of Mad River, and then also with Michael, the CEO of St. Joe's, trying to make sure that the transition can at least give us some time to do this. And so we all decided that they can push back the closure of Mad River labor and delivery only, the labor and delivery section, to the end of October. It will give us at least some time to work out the transition, making sure that St. Joe's will actually have enough labor and delivery space to accommodate the increase in volume of patients. So so we're gonna stop doing OB out of Mad River, the delivery part, on October 31st. What does that mean for us? As you can see by Tori's memo, we will still, both of our prenatal clinics, NPS and RPS, will still be open. We'll still be accepting patients. We'll still treat them the same, except now the delivery will be at one hospital, which is going to be at St. Joe's. I've been meeting with all of our OB providers on figuring out the transition, how call would look like, and making sure that there's consistency between both clinics, and making sure it's going to be a seamless transition for our patients who are used to having their delivery care at Mad River. Now it's going to be at St. Joe. So we are working on that. And so we're aiming to make everything, all of our births, over to St. Joe's by November 1st, because we're going to stop doing OB care at Mad River on October 31st, based on Mad River's decision to close their L&D unit. And so it's a huge transition. A lot of our patients have been delivering there for many, many years. And so it's a huge blow to our community. It's also another indicator of how our healthcare system does not care about women's health, specifically with delivery, with its poor reimbursement, with its poor focus on making sure that our women and children are getting appropriate care, especially in the rural community. So once again, it's a blow to our community, and coming together to find a better solution, or for all of our patients, especially our women and our kids. Okay, did not want to leave on that, but just to recap, number one, no more COVID as its own section. It's going to be known as respiratory viruses. You can look on there for diagnostic and preventive care, along with the vaccination schedule. With the flu vaccine, hold off on giving them yet. I'll let you all know when all of the sites have it. RSV, pregnant has already started giving it on September 1st. The infant and toddler will be on October 1st. The adults, they can get it at the pharmacy. And then annual performance, please, managers, start scheduling your one-on-one with your direct report. Lunch and Learn coming up on October 4th, and then our next meeting here will be October 7th. Okay, with that in mind, I hope you all have a very nice September. Take care, everybody.